More than half of everyone on Medicare today is enrolled in a Medicare Advantage plan. But here's the big problem. Starting in 2026, more than 1 million of those plans will be gone. And if you don't prepare, you could wake up on January 1st without coverage, without your doctor, and without your prescriptions. That's why this change is such a big deal for millions of seniors. So what exactly is happening? Insurance giants like United Health Group, which is the largest in the country, have already announced major cuts. United alone plans to eliminate Advantage plans that affect more than 600,000 members, mainly those on PPOs. And they're not the only ones. Other insurers are scaling back too. The key thing to understand is if your plan gets canceled, you won't be automatically switched into another one. There's no rollover, no backup option. If you do nothing, you'll default back to original Medicare. That might sound okay at first, but it comes with no prescription drug coverage and no limit on out-of-pocket costs, which could mean thousands of dollars in medical bills. This is especially worrying for people who are on PPO Advantage plans. PPOs give you more flexibility with doctors and specialists, even some out-of-network care. But they also cost insurers more to maintain, and that's why PPOs are the first ones on the chopping block. Add to that the fact that Medicare costs are going up in general. Part B premiums are projected to rise significantly. Part D deductibles are climbing past $600, and even simple copays could double or triple in 2026. It's a tough combination. Now, why is this happening? The short answer is money. Healthcare costs are rising faster than inflation. Seniors are using more care than in the past. New rules from the Inflation Reduction Act shifted a bigger share of expensive prescription drug costs back onto insurers. And on top of that, these companies are being hit with lawsuits over prior authorizations and even their use of AI to deny claims. Put it all together, and profits are shrinking. And when insurers lose money, they don't take the hit themselves. They cut plans, reduce benefits, and raise costs on the people who rely on them. That's why 2026 is being called a major reset year for Medicare Advantage. So what can you do if your plan disappears? First, you can shop for a new Medicare Advantage plan. Sometimes your current company will still offer other plans in your area, or you could switch to another provider. But don't just jump at the zero premium plans. They might look free, but once you start using care, hospital stays, or even basic services could end up costing much more. Second, you could switch to original Medicare with a supplement. Normally, getting a Medigap supplement requires health questions, and if you've had medical issues, you might have been denied in the past. But if your Advantage plan is canceled, you get what's called a guaranteed issue right. That means you can sign up for certain Medigap plans without medical underwriting. For many people, this might be the best chance they'll ever have to make that switch. And third, don't miss the deadlines. Open enrollment runs from October 15th to December 7th, but if your plan is canceled, you get until December 31st. The danger is waiting too long. If you miss that deadline, you'll start the new year with no coverage at all. So keep an eye out for your annual notice of change letter in September. Compare plans in October, and make your decision early. You've paid into Medicare your whole working life. Don't let these changes leave you uncovered, or paying thousands more than you need to. Protect yourself, know your options, and take action before the deadlines. Now I want to hear from you. Have you gotten a notice about your plan yet? Are you worried about what 2026 might mean for your coverage? Share your experience in the comments, because when we all talk about what's happening in our own areas, it helps everyone make better choices for their healthcare.